All right, okay. I want to cut across right now to our guests this evening. I have with me Dr. W. Ian Lipkin, epidemiology professor of neurology and pathology and cell biology, director, Center for Infection and Immunity. I also have with me Dr. K.K. Agrawal, former president IMA from Delhi. I want to cut across to Dr. Lipkin and all of our viewers, if you have any questions regarding coronavirus, this is the man you need to speak to. If you have any questions at all, he'd hopefully give us some answers. He's the top virologist possibly in the world. Dr. Lipkin, appreciate you joining us. And before I begin, I'd like to admit there is a certain sense of panic in our country, in India. We've seen a certain rise of cases. We're pretty much in lockdown mode. Most states are looking at that as well. If you can, for us, maybe give us the silver lining or the upside to it. Do you see us go the path of, say, a China or possibly an Italy, or do you think, it's too early to tell right now?
It really depends on the response that you have. If you really pursue social distancing, you maintain strict hygiene, you get masks out where possible, you can arrest this, but there is no question but that this virus will spread through your population, particularly amongst those people who don't have access to good sanitation so that they can maintain cleanliness. This is going to be an issue. We have the same problem here now. We are in the process of shutting down all of our universities, our colleges. We're trying to figure out what to do now about primary and secondary schools, because the problem is that the parents who do need to work will otherwise have to take care of their children. But this is something that we may come to as well.
All right. Dr. Lipkin, can you tell us a bit about how do you've given us the basics that possibly the country needs to follow, but going ahead from here, what is the time frame that possibly is crucial for India? Or would you say there is no time frame at all? Are we looking at a period of 10 days, 14 days? Is there a time frame at all that we need to look at, that where maybe we'll have a peak and possibly the waning of it, or there's nothing like that?
It's very difficult to say at this point. India does have an advantage in that your climate right now is warmer, so this may inhibit spread to some extent, because people can spend more time out of doors. The more time people spend in crowded environments, the more likely we will have some sort of spread. And in India, you have 1.4 billion people. And many people live in large cities. The density of the population is very high. So it is challenging. It's going to be important that you be flexible with social distancing. And again, although there's some question as to whether or not this is important, I think masks are useful if they're worn properly. The other thing is, as you're traveling on public conveyances, please be aware that if people are sick and they touch handles and they touch doorknobs, that you can also become infected that way. So I recommend that people wear gloves if they can. And if the government can afford to do this, it's important to wipe down these surfaces that people touch. We try to do it twice daily here.
All right.
So I agree that the prospects, if you look at the modeling that people do, can be very grim. It's important, however, to recognize that those grim projections are based upon people not doing as much as they can. So if you modify social behaviors, which is really what we have at present, I think you can reverse those models and make them look better.
All right, Dr. Lipkin, I'd like to take some calls because there are a lot of people who are calling us wanting to put a question to you. But I want to ask you one question leading up from what you said. There is a lot of studies, or, there are no studies there at all on this till now, but there are questions being raised whether climate or the weather will impact this virus at all. So when you say that we have a warmer climate, our weather is warmer, does it actually really have an impact on the virus?
I think it has an impact in two ways. One is that if you have more humidity and more warmth, the viral particles and the dust particles tend to become heavier. They don't travel as far. That's one thing that I think is helpful in your favor. The other is that if you spend more time out of doors, you don't have the same sort of contact with surfaces that are contaminated in the same way. This is also extremely important. So India has two things I think that will be very helpful, as opposed to what we have in New York right now, or in the state of Washington, which is cooler and where we have a lot of people spending time in crowded locations. We are limiting congregations, for example, here in the School of Public Health to 25. And as of next week, people are moving almost exclusively to remote work environments. And I think this is something that you can do, and it's important. And it's important to do it as soon as possible, because the growth of the virus is exponential. The sooner you can intervene, the better your chances.
All right. Well, that is what at least most state governments and even the central government is looking at doing in India. Dr. Lipkin, I have a question from a caller. Tanzeem Ahmed from Mumbai is calling in. Tanzeem, could you quickly ask your question, please?
Yeah, my question is, as a preventive measure, are we required to take vaccination for influenza as well as pneumococcal? And this applies to normal as well as those who are having smoking history.
All right, okay. Dr. Lipkin, will a vaccination against the flu or possible pneumonia really help in this case at all, or it has absolutely no correlation?
So this is an excellent question. The answer is a little bit complex. There is no vaccine right now for this particular virus. However, secondary infections with bacteria, such as the pneumococcal vaccine is used to prevent, can be helpful, and it can save lives. Frequently, with viral pneumonias, there's a second phase where bacteria come in and they actually are responsible, for the severe disease that follows and sometimes for death. The influenza vaccine is not as good this year as it is in some years. Nonetheless, it has some protection. I don't know, how old are you, kind sir?
All right, Mr.
How old are you?
We don't have him anymore, Dr. Lipkin. We don't have him anymore.
Well, let me just pass along this message anyway. For people over the age of 60, the standard influenza virus dosage is insufficient because we don't mount good immune responses. So these people have to take something called a tetravalent vaccine, which is a quadruple dose of the same vaccine material in order to get the same response. I strongly recommend the influenza vaccine because there is plenty of influenza this year.
All right.
But again, if the caller is over 60, he needs to have a special type of vaccine. It's 4 times the normal dose.
All right. Okay. So I want to move across to our next caller. I have Shikhar Mahajan from Delhi. Mr. Mahajan, go ahead, pose your question.
Hi, Dr. Lipkin. Sir, since there is no standard treatment protocol or guidelines for the doctors, so I just wanted to know that in case of people with pre-existing morbidities or conditions or high-risk people, can we, if there is an incidence of coronavirus, then can off-the-shelf medications like chloroquine and this HIV and Umifenovir and Tamiflu be given at the initial stage itself together, or it's going to be counterproductive? I mean, is there anything that you can guide us on?
Mr. Lipkin.
So you mentioned, yes. Yeah, I'll repeat the question. The question is whether or not there's any medication that can be taken to prevent infection with this virus, and then a number of medications were mentioned. I can tell you that Tamiflu, which is a drug for influenza, does not have value. Tamiflu does not have value. There is some question as to whether or not the chloroquine derivatives may be useful. To my knowledge, yet they haven't been tested in this way. I will tell you that there are treatments that are coming online that will be useful in post-exposure prevention as well as in treatment. We hope that they'll be out within the next few weeks.
All right, I'll take one more question that we'll cut across to the other guest on the show. Rohit Kapoor is joining us from Mumbai. Rohit, go ahead, pose your question.
Yeah, actually, my sister works in
We're having a bit of an audio problem, Rohit. I'm sorry, I'll need to skip and maybe you can try back later. Dr. Manan from Mumbai. Dr. Manan, go ahead. Okay, all right. There seemed to be an audio problem there. We're going to rectify that. But Dr. Lipkin, just stay on with me. I'm also introducing into this conversation Dr. Agarwal, who's joining us, former President IMA. You know, Dr. Agarwal, there's a lot that we can actually take from what Mr. Lipkin is suggesting. Would you reckon this is the way forward? And I think if there is one thing that has come across, and that is social distancing.
So first of all, let me say Corona Namaste to everybody, including Dr. Lipkin, because that's what we are promoting as a medical profession. I'm going to come back to some simple statistics, which I also would like Dr. Lipkin to comment. If we go back to all the countries, we have now an experience of more than 2.5 months of various types of phases occurring in various countries. So we have learned lessons from them. So therefore, we should be able to reduce our mortality taking the South Korean way. Say, for example, 17.3 per million population is currently the affection in 127 countries. If I take that India also remains in that average, maximum worst scenario, we will get 22,000 patients. If we take an Italy-like situation, which is unlikely to occur in India, where is elderly population is very high, they have 250 per million. In a China-like scenario, we have 56 per million. If you take US as a scenario, it is 5.2 per million. So if India behaves like US, we will have 6,760 patients. And if we have a New Zealand scenario in India, we will have 1,300 cases. And if we stay at 0.1% presently in India, we will have between 130 to 200 cases coming. So from preparedness point of view, these cases are manageable. Today, the ministry has invoked Essential Commodities Act. They have also invoked the Disaster Management Act, which we have been asking for the last 2 months. The prices of Tamiflu, the prices of masks, the prices of sanitizers gets from today, they absolutely get capped. So therefore, commercialization of corona will not happen from today. So that's a good news which we are occurring. So I particularly feel what Dr. Lipkin has said is absolutely correct.
Okay.
We have manageable numbers. The only thing we require is not to do a mistake what happened in Karnataka yesterday. These types of mistakes can absolutely slay something.
Okay, but Dr. Agarwal, Dr. Lipkin is actually...
Let me explain about yesterday's Karnataka. In Karnataka, it is...
Okay, I'll come back to you. Maybe you can explain that case. I also want to bring in Dr. Randeep Guleria. He's the director, AIMS. He's also joining us. Appreciate you joining us, sir. I want to go back to Dr. Lipkin's on what Dr. Agarwal said. Dr. Lipkin, is it as straightforward and easy as statistics as Dr. Agarwal put in, or do you think there's a lot more to it?
Well, I appreciate Dr. Agarwal and his expertise, and I hope that he's correct. I fear, however, that the numbers will be much larger. And the reason I say this is that the number of people who become infected that we detect is a function of how much we test. And we think, at least in the United States, that our numbers are going to be much, much larger than we appreciate now. And we are very concerned about a situation like what has occurred in Italy. And as a result, we are moving into a crisis mode. And I hope, as I say, that this does not occur in India, but I think that you must be prepared for this. I don't want to so panic, and as I say, I hope he is correct. But the only way in order for that to happen is if you test extensively, pursue social distancing, and find ways to minimize this spread from surfaces. Because here, we were not concerned at all. and then over the past week, it has exploded. And that's the way this virus is behaving. It's beneath the surface, and suddenly there's this dramatic increase because it grows, at least doubles every cycle.
All right.
Some people think it's doing more than doubling.
All right, Dr. Lipkin, I want to go across to Dr. Randeep Guleria as well, but I want to ask you one question before I do so. Do you actually see a possibility of India going the Italy way? Because what's happening in Italy right now is pretty much catastrophic.
As I say, my belief in hoping for the best and preparing for the worst.
All right, okay, stay with us, Dr. Lipkin. Now, we want to ask you a few more questions. We are getting a lot of calls wanting to pose basic questions because, there's so much in terms of myths that are associated with the coronavirus as well. I want to cut across to Dr. Randeep Guleria. He's the director of AIMS. And Dr. Guleria, are we prepared? Are we testing enough is the big question.
So we are in a different phase as compared to Europe or as compared to the US. Currently, our testing is basically limited to people who have come from abroad or who are close contacts, because unlike the US or Italy, we don't have a large community spread. But we have already put in place a large number of viral labs. More than 50 are in place, and this can go up to 80 for testing. And if there is a need, we can always have a backup from the private sector. So I think if we have already made plans to upscale the labs if required, and I am hopeful that if there is a need, we should be able to do it. We were able to do it during the H1N1 pandemic, when again there was this huge issue of testing and who should be tested, and should everyone be tested, or it should be done based on a risk assessment. That sort of plan is already there, and it will get activated once the scenario changes. So this is a pandemic which is changing day by day, and we have to be sort of prepared for the changes or the way it moves in different regions, in different countries.
Okay, Dr. Guleria, I want to ask you one question before we let you go, sir. And the question I want to ask you is, when you say we're in a different phase from Europe, why do you say we're in a different phase from Europe? Because all the, the research that we are getting in seem to suggest that there seems to be a difference between the way Italy has gone and possibly South Korea. The reason South Korea hasn't registered the number of fatalities as possibly Italy is because it's constantly testing a lot more than Italy did in the beginning.
Yes, so I agree there are multiple reasons for that. But one reason, of course, is testing. The other is picking up individuals early, especially the high-risk individuals, admitting them and starting treatment and management early rather than late. My own feeling is that we have the capacity to do that. Currently, we are not doing it because there is really no need. But if we have a cluster of cases, as happened in South Korea, or has happened in Italy, or in many parts of Europe, we should have the capacity in place to treat, to test, and also upscale our health facilities in terms of isolation wards, in terms of ICU, in terms of ventilatory supports, and also in terms of training our health force so that they are properly protected and they don't get infection while they are looking after the sick.
And do we have that?
So we are already doing that for the last few weeks. We have had plans in place where at state level, at the central level, hospitals and isolation wards have been curated.
Okay.
A lot of equipment has been purchased and bought and kept in place. And also there is regular training both at a state level and training of trainers that has been going on for the last few days in terms of how to wear personal protection equipment, how to manage these patients, ventilatory management, and ICU care.
But Dr. Guleria, do we need to now start testing more and not just, testing the high risk?
That is
Okay.
So as like I said, as the situation changes, we will have to change our policy for testing more, and we will probably move gradually into that phase where we will start looking at the high risk group, or even individuals who have symptoms suggesting of coronavirus but may not have a history of travel. We have not currently reached that stage, so there is no need to start testing in large numbers when we don't really need it as of now.
All right.
But having said that, like I said, we need to be prepared, it may change at any point in time.
All right, Dr. Guleri, I appreciate you joining us. I'm going to go into a quick break, but we are back with Dr. Ian Lipkin, just a 10-second break there. And we have a question coming in from the national capital. DVN Rao joins us. A quick break, back in 10 seconds. All right, so unfortunate news coming in as we quickly cut across to Dr. Ian Lipkin, top virologist, and a caller who wants to ask him a question. We will confirm right now there has been the second confirmed death of coronavirus. It's happened in Delhi. A 69-year-old has perished, has died. That's the latest that we're getting in. I want to cut across to a caller who has a question for Dr. Lipkin. DVN Rao, pose your question, sir.
Hello, sir. Good evening, sir. Dr. Lipkin.
Ask your question, Mr. Rao.
Good evening.
Yeah, I want to ask one thing. Some cases are there, they are now cured, and they are freed also. At this stage, I want to ask one thing. That are they really using the correct methods to cure the coronavirus? Because you are saying there is no medicine for this. Or it is temporarily dormant for that time and will again surface after some time. Are they permanently cured or they are temporarily cured?
Dr. Lipkin, can somebody who has been cured of coronavirus, can he once again get it?
We don't think so. There are some people who think that reinfection may be possible. The other possibility is that they never completely cured the infection. I would just like to respond to the previous comments about the status of testing in India. I find that very encouraging. I understand that it makes sense to not test until it becomes clear that you have clusters. And I wish you well, because this is going to be very difficult. When it starts to build up, we quickly became overwhelmed. Here in New York City, for example, we're short of testing. So maintain your readiness in case you need it.
Okay. Prabhat from Delhi has a question. Prabhat, very quickly. Prabhat, will you ask your question? Okay, we don't have Prabhat. Subhashish from Kolkata, ask your question.
My question is that for a senior person, we are vulnerable, right? So my wife takes a immunosuppressive drug, as part of rheumatoid arthritis. So is it advisable to continue this medicine for next 3-4 weeks? Because immunity is one system which may get affected by this virus. So that's my question as a preventive measure.
Dr. Lipkin, immunosuppressant drugs, should people discontinue them?
If there's a possibility that she can do all right without them, then I would encourage her to do that. Because, as you've said, immunosuppression is a major risk factor.
Is there anything, doctor, that anyone can take?
For example, let me finish.
Yes.
For example, if somebody's taking chemotherapy, or somebody has a life-threatening condition that requires these therapies, that would not be advisable. You should consult with your physician and see what he or she thinks makes most sense.
Dr. Lipkin, is there anything that anyone can take orally to possibly increase immunity in these times?
I can't really recommend anything that's proven.
All right, so there's nothing that is proven. Let's take another caller. I have Payal from Kanpur. Payal, please ask your question.
Yeah, good evening, Dr. Lipkin. I have a 6-year-old boy, and he has had all his immunization till date, from his birth till date. I would want to know, as you were saying, can we give him influenza vaccine so that his immunity level goes up against this virus?
Dr. Lipkin?
Yes, but if your child is 6, I would ask why he has not received his vaccines.
All right. Doctor, just take us through. You're saying masks could actually be helpful because a lot of governments are discouraging people to actually wear masks. You would say masks is a good thing?
I think that masks are a good thing. There are 2 reasons why masks are not recommended. The one is that they're in very short supply. Number 2 is that people don't wear them properly. The idea behind a mask is that it discourages you from touching your face. Anything that will be helpful in preventing you from carrying virus from the environment or from somebody else whose hand you have shaken, which you shouldn't be doing anyway, to your face, I think is helpful in preventing this problem. When you travel through Asia, you'll see, I mean, not South Asia where you are, but China, South Korea, Japan, people are wearing masks all the time. And I think this has been helpful in control of this outbreak. In 2003, during SARS, there was a study that was done by WHO that actually showed that there was a reduction in, welcome to my life, I'm sorry, this is just the way the phone is always ringing, that showed that there was a reduction in community transmission. So this is important. But there will be people who tell you that masks are not important and that they're not advisable. I have not heard anybody say that masks are dangerous.
Right.
And on that basis alone, I feel comfortable recommending them.
But Dr. Lipkin, you also talk about wearing gloves. Are gloves a good idea to, actually go out in public spaces?
I don't think you need sterile gloves. Any glove will work. Anything that prevents you from having to hold onto a subway or a bus handle with your bare hands is something that's very, very useful.
Dr.
If you do that, make sure that you wash your hands immediately afterward. But what you will see on a public conveyance is somebody goes like this, holds this, then I come along, I grab the same thing and I go like this, and basically we've taken something from here and put it in the other side. So this is a problem. And if you have a glove on, you're more likely to take the glove off before you touch your face. So some of this is really just common sense.
Right. Dr. Lipkin, a lot has been said about possibly your clothes picking up the virus. Is that a possibility? Does the virus sustain on your clothes for long?
It is a possibility. If you think about porous materials like cardboard, we know that the virus can live on that for up to 24 hours. But there's a limit to what one can do.
Right.
So I don't think most people can wash their clothing every day. So I prefer to focus on those things which I think everyone can do, so that we don't make it so impossible.
All right, Dr. Lipkin, we have to tell you there is a sense of panic, and hopefully this conversation with you would allay some fears in India. Abhijit Gupta from Kolkata wants to ask a question. Abhijit, please make it quick.
Sir, good evening. What I would like to ask is, as you mentioned that as the temperature rises and the humidity also rises, the coronavirus travels a bit slower than as it is doing right now. So would it be advisable to move to a warmer place, or say with the onset of the summer, would the, the effects of coronavirus get reduced?
It's a good question. I know many people in the United States who are moving either out of cities or into warmer climates. The explanation for how this works, I think I've given you, it's scientifically plausible. It certainly plays a role in influenza transmission. We don't have any data yet directly on this coronavirus, but based on the similarity, I would say, to methods for passage of respiratory tract infections, I think this is important to consider. I also point out, however, that there are many influenza virus outbreaks in South China and in Indonesia where it's warm. So all we're talking about really is a relative risk reduction. I'm not saying it's a solution. The best way to keep yourself safe is to avoid crowds, to maintain excellent hygiene, and to avoid touching surfaces that may be contaminated, and trying to avoid touching your face. The majority of people who are going to be ill and severely ill or die with this are going to be people who have some sort of underlying medical condition or are older. So with younger people, our responsibility is primarily to prevent infection of older people. Children, for example, seem to be quite resilient, and they may be carriers of this.
All right, before we take our last caller, Dr. Lipkin, if somebody is experiencing symptoms before, or just like a flu-like symptoms, should they self-isolate or would you recommend they get tested?
I would recommend that they self-isolate, make a call to a hospital or a clinic, which I'm sure your excellent physicians are setting up, and make an appointment to be seen. And if there's any possibility of making sure that they have a mask on before they go into a crowded clinic, that would be very, very helpful. There is no question that everybody believes who's involved in this at present that if you are sick, wearing a mask will prevent infection of other people, or at least reduce that risk.
We'll take a final caller. Shilpa from Bengaluru joins us. Shilpa, go ahead, ask your question.
Hello.
Ask your question, Shilpa.
Hello. Yeah. Doctor, actually I wanted to ask that a virus is said to be in an incubation period. That time a person doesn't show any symptoms. So will that be person still spreading the virus?
Yes, the incubation period has an average time of 5 to 7 days. There are some people who either have mild symptoms or in some cases no symptoms, and they are still shedding virus. So this is a concern. So we don't yet know whether or not there's a particular phase where the amount of virus shed is much more infectious. I would predict, based on analogy to other systems, that this is going to be sort of earlier in disease when the virus is primarily confined to the upper airways, and when you might be sneezing large amounts of virus, for example, or coughing large amounts of virus.
Dr. Lipkin, before you go, is there a crucial phase right now for India? Going from here, do we have a crucial period?
I think you do have a crucial period, and after listening to the physicians you had with me on this broadcast, I am convinced that they have matters well in hand, and I hope that India escapes unscathed. And I'm reassured that they are preparing that in the event that doesn't come to pass, that they will be able to mitigate the damage. I'm sorry that I was not able to join you in New Delhi. I was supposed to be there with you today and yesterday, but some other time. I look forward to seeing you again soon.
We too, sir, definitely look forward to seeing you. We've also, in light of the current circumstances, it was conclave in the times of Corona. We've decided not to have it, but we've done away with the conclave. But we're going to have it really soon, and we're hoping you join us then. Appreciate you joining us, Dr. Lipkin. A lot of viewers have been... Thank you, sir. Appreciate you joining us. Thank you, Dr. Agrawal. I'm going to go into a quick break to stay with us. We're back shortly. Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.